Today we have 12,212 cases and 179 deaths. Many of those cases. Yes?
I have to interrupt you. Your microphone has a real gravelly quality to it. I don't know if there's anything that can be done.
How's that? Better?
I think a little bit better.
I think maybe I just need to turn it, maybe it's a little hot. Hang on.
I mean, I can still understand you. It just sounds gurgled a bit.
Oh, you know what? It's using the wrong microphone. Hang on just a minute. Microphone. It's not even showing my microphone. Hold on just a minute, everybody. There we go. How's that?
Much better.
Yeah, that's my fancy microphone.
I can tell. It sounds significantly better.
Yeah, for some reason it wasn't picking that one up. So I will start over. We have today 12,212 cases and 179 reported deaths. We are still tracking around 3,000 of those cases that are active and the other 9,100-ish that are recovered. Case fatality rate now at about 1.5%. We have seen fatalities increasing through the months of November and December as cases have been going down through the month of much of the month of December. Hospitalization wise, we really have been hovering in about this range in terms of hospitalizations. We currently have between Sparrow and McLaren 161 confirmed and suspect cases. 152 of those are confirmed, with one being pediatric. 18 of those are in the ICU, with 17 ventilated. And emergency department visits, previous calendar day, which is actually 2 days ago, was 47. So if you look at this chart of hospitalizations over time, as I said, you can see we've been just really since early to mid-November, we've really been in this 140 to 160 inpatient at Sparrow and McLaren combined for that entire period of time. So this graph is just a little bit more information, but it only starts in August because of the reporting changes. So we can see in this basically that ICU number, which is the green bar. This chart also shows that basically since about mid-November until now, we've been really hovering in that same really range in terms of hospitalizations, bouncing up and down a little bit, but we really just have kind of plateaued there. The pink line that's bouncing around is that emergency department visits, which did seem to drop around mid-December, come back up a little bit. Looks a little lower than it was in the past. Our patients ventilated has been gradually increasing through mid-December, and looks like it could be going down just a slight bit. So just looking again, we have 74.5% of our cases recovered, 24% are active, and 1.5% deceased. This is our cumulative curve. We are just continuing to watch this curve and want for it to plateau. So what we expect to see is a flattening of this at some point in time when cases are no longer increasing at a high rate. So when you see those steep parts of the curve, that's when we're really having large number of cases per day, which are accelerating the number of cases we have cumulatively over time. Looking at our incidence curve, not smoothed out in a 7-day rolling average, you can see, as I said, that we have been through the month of December gradually declining in terms of our number of cases per day. Our percent positivity remained fairly high and is really just now starting to kind of come down a little bit. So you see these numbers here starting to come down in percent positivity. When we look at those in 7-day rolling averages, you can see a little bit more clearly that that percent positivity metric is indeed starting to trend downwards. We are now down below 8% for the first time in quite a while. By zip code, we still have the majority of our cases in 48823, followed by 48911, 48910, 48912, as well as 48854, which is the Meridian Township, Ashtamo area. And then we go on down from there in terms of number of cases per zip code. So by rate, again, with the number of cases in the East Lansing area, even though they are our highest populated zip code, they still by rate also are the highest rate zip code, followed by the zip codes 48910, 48911, the Holt zip code, the Mason zip code, and the Dansville zip code in that next category. Then we go to those kind of greenish colored zip codes, which include Hazlitt, Williamston, Weberville, and Leslie at the next level. And then we go down to the 48906 Lansing zip code, as well as Onondaga and Stockbridge and Okemos in that next level by rate. If we look at a heat map, we still do see that, strong sense of number of cases there in the East Lansing area. This right here, most of the time when we talk about this, and you'll see it more clearly on the next map, is that concentrated circle, which usually is a single address or a apartment complex. This particular one is not an apartment complex. What it is a number of cases that are coming in with a single address on them, which I believe is the address of the provider that is not putting patient addresses in there. So they're all going into the system with that address in it. It doesn't have a number to it. It just has a 48912 zip code to it. And so all of those are probably landing right exactly where the 48912 post office probably is. So that is why they are all being geocoded right into that spot, because they don't technically have a street address to them. And honestly, it's hard to tell where the majority of those cases land. So looking at the numbers in that zip code, it's important to also take that into account. That's about 165, 170 cases that are listed at this particular address that we are in the process of trying to figure out how to rectify that issue. It's been happening really since November. It has accelerated. We did see a little bit of it in September and October. There were a couple of them back in April. So this has really been accelerating, which is why we haven't seen that hot spot until now. So when we do look at the zoomed in on that East Lansing area, then you do see these circles around, that larger kind of right across the street from campus area, which again are those apartment complexes that are in the 48823 zip code, as well as this one in the Lansing zip code. I forget which one it is exactly, but this is Skyview Apartments over there near Frandor. Cases by sex are starting to shift a little bit, where we are 52% female now and 48% male. We were running about 50-50 for a really long time. Then we started to go 51, 49. So we do actually see a little bit of a shift going on there right now. I don't know if that will hold true, but for right now, that is where we are. By age group, you can see that the 10 to 19 age group is leveling out, along with the 30 to 39, 40 to 49, and 50 to 59. And we still do see that higher percent of cases in the 20 to 29 age group. I think we did get to 42%, 42 or 43% at some point in time, but we are down at 31% in that 20 to 29 age group right now. Our cases are 60% Caucasian, 12% African American, 15% other, 4% Asian. I'll just remind you again that when we get into that other category, which includes, Pacific Islanders, Native Americans, those sorts of folks, we don't truly have that many cases in what is a traditional by census other category. This really goes to an issue related to the way we collect data and information and the way the census displays data and information, and the fact that many Latino folks do not identify as either Caucasian or Black. And so they basically choose other because Hispanic or Latino is not considered a race in the way that we collect demographic information. So when we look at those prevalence rates by adjusting for population, so this is a per 100,000. So if every one of these populations was 100,000, this is how many cases we would have per that 100,000. So 4,582 for African Americans, 3,401 for Caucasians. That's about a 1.34 fold difference. Disproportionate burden of illness on our African American Black population. When we look by ethnicity, 74.4% not Hispanic or Latino, 8.2% Hispanic or Latino, and the remaining unknown. That rate difference is about a 1.28, 1.3 fold difference at 3369 and 4336. So again, you do see that disproportional disease burden on our Hispanic Latino population as well as our Black and African American population. When we look at our deaths by age, we are 2.2% below the age of 40, 1.7% 40 to 49, 6.1% 50 to 59, 14% 60 to 69, and then we get into our largest categories where we have deaths. This has been going on since the very beginning of the year, since we very first started hearing news and reports of this pandemic from China, where we really did see the vast majority of deaths in the 70 plus age group and even significantly more in the 80 plus age group. And that is basically a statistic you see across the world, across the country, across the state. By sex, deaths are 44.7% female and 55.3% male. So we kind of flipped because we were 48% male and 52% female in cases. But when it comes to deaths, we are a lower percentage of deaths with females rather than males. And I think that difference is also starting to widen a little bit if I remember a lot of previous graphs. But I have a lot of numbers in my head, so you'll have to excuse me if I was wrong. Percent of COVID deaths by race, 18.4% African American, 73.2% Caucasian, 1.7% Asian, 2.8% other, and 3.9% unknown. By ethnicity, 87.7% not Hispanic or Latino, and 5% Hispanic or Latino. When we look at deaths by zip code, still 48823 with our 39 deaths, followed by 48911 with 32. Those are our two zip codes with the highest number of cases. So it is not at all strange to see that those two zip codes are also our highest zip codes when it comes to deaths. When we look at that death rate per 100,000 population in our African American or Black population compared to Caucasians, that too is about a 1.34 fold difference, 75.9 to 56.4. Right now at the state, the disparity rate between African American and Caucasians is slightly over 2. The national level, I believe last I checked, they were reporting a 2.8 fold difference between Caucasians and African Americans. So our case rate difference is the same as our death rate difference in this county. So we see about a 1.34 fold difference in cases, and that same difference between Caucasians and African Americans when it comes to deaths. When we look at our deaths by month, you can see that, as we started to have these significant outbreaks and then the significant increase in case rates. So we had a significant outbreak in September. So we see our deaths tick up in October. By October, we were starting to see this surge in cases in the county and across the state. So then we see, deaths in November, which were 48, and now we are at 58 deaths for the month of December. I believe, I think I got an email the day it might have been Christmas Day. I think we had 4 or 5 deaths on Christmas Day, which was a very sad email to receive. They all are, though. They all are. So this is our deaths by week. Hopefully that number is starting to come down as well. So you look at those last 4 weeks, and we did reach an average over a 4-week period deaths per week at about 15.5. So hopefully we are trending down from there, but of course we are all bracing for the possibility of what might happen during the aftermath of the Christmas holiday and travels and gatherings and those sorts of things, and hoping that perhaps it will be as little, and yet there was an effect after Thanksgiving, but hopefully minimal. Hopefully we did have people that, you know, stayed home, gathered in small groups, did the appropriate gathering safely, in terms of guidelines for that. So that is the end of the PowerPoint. I would be remiss in closing out the new year and news briefings for the new year without talking about 2 things. And one is the amazing team that we have at the Ingham County Health Department. Everything from our health centers, who provide direct primary care to patients and have continued to do so throughout this pandemic. Basically, you know, changing over to televisits, you know, using just, you know, creative thinking, creative technology to continue to provide quality care across this community. Our public health services folks who have been, again, continuing to do much of the work in WIC, immunizations, our home visiting programs, those sorts of things. Many of those things have been telehealth, home visiting as well. But really a shift in the way we deliver services, but still the ability to do that. And then really the addition of staff through, you know, temporary staffing, contractual staffing, those sorts of things, you know, resources through the CARES Act that did come through the state and to the department to augment our ability to do contact tracing, testing, our health centers, as well as our public health services testing events. So we had testing going on at Forest Health Center on a regular basis, as well as our public health services team going out into the community and doing pop-up testing events in many, many places. And then, you know, on top of that is basically just staff across the board who have been, you know, basically reassigned and redirected to basically put all hands on deck when it comes to, we needed to do testing, we needed to do contact tracing. Now we need to do testing and vaccinating and contact tracing. And so, as you might guess, we have any number of people that have been assigned any number of tasks that are not part of their regular job duties. And it is an amazing sight to see this team of Ingham County Health Department folks who have just done a yeoman's job of responding to this pandemic. I just lead and speak to the media and explain what's going on. The work of what's going on in this department is happening there, and all credit to them for the incredible, incredible work that they have been doing for this entire year. The other thing that I would be remiss in not mentioning is partnerships. So this area is remarkable. I will tell you that probably one of the reasons Ingham County has done as well at times as it has, and you know that there have been times when we've looked at other counties in the state or other parts of the state or other states, and it's like, why are we doing better than maybe, you know, over here? I would put this health department and this community up against some of the best in the country in terms of working on this pandemic. We have had amazing partnerships with, first of all of you. You know, I want to thank all of you for helping us get messages out, get communication out, get clear information out to the public as frequently and as often as we can. I appreciate all your questions every week, because beyond just talking about the data, your questions help everybody understand what's going on. I know you're pushing this information out. I get the questions as a result of, you know, I saw, you know, channel whatever put it on their Facebook and you know what, and you know, I heard those answers to these questions. We've had an amazing partnership with our Chamber of Commerce. We have an amazing partnership going on with MSU, many community leaders, the Ingham Intermediate School District, as well as the other school districts. But my point person really has been the Ingham Intermediate School District to really work with and get word out to the school districts. CATA has been an amazing partner with providing rides originally to testing, and now talking about, providing rides to people for vaccination. Our cities, East Lansing and Lansing, both for work with ordinances and enforcement and partnerships over all of those sorts of things. But really, that enforcement work spread far beyond the cities of East Lansing and Lansing as well. So I have law enforcement colleagues across this county who have been there for us when it came time to need to work on enforcement issues with businesses. I want to particularly mention right now that we have been working with Lansing Urgent Care, who very quickly stepped up when we started doing this vaccination event and said, we will be there for you. We will have staff there for you. We will staff it ourselves. We will coordinate it ourselves. They're there side by side with our team, providing about half the resources and half the ability to do the vaccinations that we're doing, really by coordinating it themselves, getting their volunteers themselves, scheduling themselves, taking all of that off of our plate. So we just manage our own. So Lansing Urgent Care has been a tremendous partner. Both health systems have been tremendous partners. And lastly, I'll mention that SETSAG, who also provides insurance to school districts, has stepped up through some of their practices to assist us with getting vaccination out to school personnel as rapidly as we can, as they rise really to the top of that 1B group. Law enforcement, fire departments, obviously our 911 operators, as well as school teachers and some other folks, really high priority in terms of getting into that 1B group and having that partnership to get to really thousands of people across the county who are employed by school districts, daycare centers, et cetera. I could just go on, but it's, this constant, somebody sees that we are about to start vaccinating or about to start testing, and before you know it, I am getting phone calls or emails offering help. And that's what happens in Lansing, in Ingham County, and in this Tri-County area. And I just couldn't be more proud and thankful to all of you, as well as all of these many partners.
Thank you, Linda. Does anyone have a question? All right, we'll start with Scott Pohl. Go ahead.
Hi, Linda. Happy New Year. I'd like to ask you about the team that you just spent a few moments praising. I'm curious about the extent to which staffing may have been an issue at any point throughout the year. Were you able to hire more people? Is your staff about the same size it was when all this began? Anything you can expand on the performance of your team? We
have been able to hire folks with the funding specifically for COVID response. So that doesn't mean they'll be with us forever, but as long as we're needing to deal with COVID response and continue to have the bills passed at the federal level, as well as, the legislature working with the governor at the state level to continue to get funding out to help. So yes, we have added staff, quite a number of staff really with contact tracing and case investigation, as well as some staff related to testing. We have not added a lot of staff right now in terms of our vaccination efforts. That has been largely a redirection of staff from other areas. And, we probably would have struggled with that had we not had partnerships with Sparrow. We had Sparrow doctors out there as well, McLaren, and like I said, Lansing Urgent Care. That really, saved the day for us in terms of being able to staff that event, or that not event, but that clinic. So yeah, we have been able to do that. And we've also had a lot of people who just, when the question comes like, can you do this? We're going to put you on this. And they say yes, and they do. And it's been remarkable.
And a quick follow-up with regard to the vaccinations. I know you got your vaccination, others on the staff. What's the pace of that within the county health department staff?
What is that now?
I'm curious about the pace that you and your staff are getting the vaccine yourselves. Where are you in that process?
Right now, we are still getting 975 doses a week. I am pushing the state hard to double that allocation because at this point in time, we are vaccinating 350 or more people a day. And we could do double or triple that if we had the vaccine to do it. So we are hoping that they will double our allocation. We did ask for the 1,950 doses this week and didn't get it, but we will be asking again. And I've also made a few phone calls to see if we can. It's like, our limiting factor right now is having enough vaccine in to get people in. It's not the schedule. It's not the staff to be able to do it. We can do it. We could do more.
Who are you vaccinating with the vaccine you have then? I was only asking about your staff. It sounds like that's.
Oh yeah, they're all, everybody that needs to be vaccinated has been. We are, obviously pacing out our staff vaccination as well. The state basically is now doing the entire 1A group. So you're talking about health systems. So hospital, anybody that works in a hospital and provides care, that 1A group was hospital floor, ICU, emergency department, and then went on from there to, high risk procedures, dental offices, then got to outpatient clinics and urgent cares. And we are doing all of those groups right now. EMS also in there, by the way.
Thank you.
Ingham County stepped up to do the tri-county EMS. So we did EMS for Clinton, Ingham, and Eaton County.
Thanks.
Mm-hmm.
Craig Lyons, go ahead, please.
Yeah, Linda, I know you just kind of addressed this a little bit with Scott's question. So what is your total figure of people that have been vaccinated so far? And how would you rate and how would you assess how the process has gone and what it might look like moving forward?
So I can't tell you an exact number that have been vaccinated so far, although the state does have a website that will show you that. And I was just looking at it not that long ago, and I wish I remembered the number. Because you've got to remember that we get an allocation as a health department, but Sparrow Health System gets an allocation, as does McLaren. Sparrow and McLaren then basically are not vaccinating people only in Ingham County. They're vaccinating, across their systems. And there's, their satellite health hospitals like Sparrow Satellite Hospital. So I can't tell you those exact numbers. I can tell you that basically we have vaccinated basically as many as we can. So we had an allocation of 975 the first week. And last week we actually vaccinated slightly more than that, closer to 1,000, because we had our second allocation in and started using that. This week we are also on track to use every bit of vaccine we have, and the same for next week. So this health department is vaccinating 975 people a week, although slightly more at times, because what we're finding, which you've heard about this, or you may have heard about this, the Pfizer vaccine has often got an extra dose in it. So there are times when you're pulling that vaccine out of a vial and there's some left, if there is enough to complete a full dose in a vial, then we are basically allowed to go ahead and use that vaccine. The only thing we can't do is take a little bit left from one vial and a little bit left from another vial and combine them together. That is against the rules. So in reality, for those 975 doses, a lot of times there's an extra dose for every 5, and I'd have to do the math on the percent of that real quick to, what is that, another 15%, something like that. So we definitely are a little higher than that 975 a week right now, but we are vaccinating at a pace that is really exceeding our vaccine allocations at this point in time. So, we're operating Monday through Wednesday. We're talking about shortening that down to do 2 days a week so that we keep our providers and our vaccinators obviously busy rather than waiting. So that's what I know. Amanda, maybe you can find the state's COVID vaccine update website. They've got those metrics up on the state's website somewhere.
I'll take a look. If I can't find it while we're on the call, I can send it out via email. So I don't have any questions in the queue. Oh, there we go. WILX News 10. Go ahead with your question.
Hey, it's Rachel. Just a quick question. Happy New Year, by the way, and Merry belated Christmas. So in Chicago, there was a couple that had lost their lives. There was an article that came out due to COVID. So I was wondering if you had any thoughts about that. Do you think salons are safe? What do you think salons should do in order to keep people safe, or is there anything else in regards to that?
Are you talking about hair salons?
Yes.
Nail salons?
Hair salons specifically. Yeah, there was an article that came out. I can send it to you where a couple had lost their life due to COVID. So I just wanted to ask what your thought was, because I've spoken to a couple health professionals that says that the virus loves hair.
Oh, I've not heard that. So I don't know anything about hair and the virus. Obviously, any place where, droplets can, then you would be talking about a surface. And many of the articles that have come out recently, and I saw another one just yesterday, has really started talking about the fact that we focused on surfaces at the beginning, but we're really finding that it is largely aerosols and droplets that we're breathing in, not things that we touch and then touch our nose, face, and mouth. Here in Michigan, people must wear masks in salons, as well as workers in salons wearing masks. They should be disinfecting, decontaminating, and they should be keeping capacity down. We have not seen issues with salons here in the county nor in the state, which is why they've been open. I don't have any way to verify that information about the virus in hair. It's certainly not, it would be something that it would land on your hair. It's certainly not incorporating into your hair when it infects your body.
Thank you so much. And then I have another reporter to ask a question.
Hi, I'm Diamond Daniels. I'm the other reporter here at WILX. I have a question about whether or not it may be a little hard to predict, but do you possibly foresee there being like a spike in numbers after New Year's Eve?
I will say we are all bracing for a spike in numbers following both holidays. We have Christmas and New Year's Eve, a week apart. And we know that airports were fairly full. We know that there was a lot of traveling. I don't know about you, but I saw lots of pictures of some fairly large gatherings when I scrolled my Facebook feed, which is a little disappointing. It seemed fairly minimal. A lot of people were, taking heed to the advice and keeping those gatherings small. But, time will tell how dramatically it may impact numbers. But that is one of our biggest concerns right now, is that we are, as you can see, we've been plateauing with hospitalizations for months, for weeks now. We can't afford for a surge to cause those hospitalization numbers to, double. We don't have that kind of capacity in our health system. So a surge could dramatically impact our healthcare system capacity when they've been fairly maxed out. They aren't at maximum capacity, but they are just below. And so there's not a lot of wiggle room there to continue to, have a surge in cases and then see the subsequent hospitalizations that result.
And I think I heard you say that there was a total of 45 deaths on Christmas Day.
No, 4 or 5.
Okay.
Yeah, no, not 45, 4 or 5.
4 to 5, okay.
Yes.
And then also for Ingham County, I wrote down that according to your slide, that there were 621 active cases. Was that right? I saw a larger number, so I wanted to make sure I got those right.
No, the active case number is, I think it's 2,000.
Okay, yeah, I saw that larger number, but okay.
3,000, 2,936.
36, okay.